In this presentation, we're going to teach you a little bit about umbilical care.
Hi, Wesley. Congrats on being a new dad.
Thanks. I'm actually really excited. Cutting the umbilical cord was a little terrifying, but I have no idea where to go from here. How do I take care of it?
We're both going to give you some pointers on your new baby's umbilical care. Sounds good?
Yes, please. I'll take all the help I can get.
Great. The most important thing that you need to remember is to keep the umbilical cord clean and dry. The umbilical cord will naturally fall off on its own, and keeping it dry will help it to fall off faster.
This means no submerging the baby in water, so no baths. Instead, use a clean washcloth with mild soap and water and give a sponge bath. Make sure that you wash one part at a time and dry immediately after so that your baby does not get cold.
Okay, perfect. So I don't have to worry about bathing the baby right away. That sounds pretty easy so far. I'll just give a sponge bath, like you said, and make sure to keep the cord area clean and dry. When it starts to fall off, should I remove it so it doesn't get caught on the diaper?
That's a great question. Actually, you should just continue to care for it the same and let it fall off in its own time. If you pull the cord off, it could hurt your baby and allow an entrance for infection. Think of it like a scab. Just let it heal all on its own.
When changing your baby's diaper, you should fold the diaper below the umbilical area. Folding the diaper will keep the cord open to air, allowing it to stay dry. So you shouldn't have a problem with it getting caught on the diaper. Can you repeat what you learned so far?
Yeah, sure. So I definitely won't pull it off, even if it's hanging by a thread. I'll continue to care for it, keeping it clean and dry so it doesn't get infected. Now, when I put the diaper on, I'll just fold it below the umbilical cord so it stays open to the air to dry. Is that right?
That's perfect. You're doing great.
Whoa. How will I know if there's a problem or if bacteria accidentally gets in? Accidents happen, right?
So the signs of infection will usually consist of tenderness to the area, redness on the skin around the umbilical cord, and keep an eye for a smelly, mucousy discharge that could vary in color like yellowish or green.
You said tenderness. How will I know if it's tender if the baby can't tell me?
Normally, the umbilical cord should not hurt. So if your baby starts crying while you're cleaning the area, that's definitely a sign that it's tender, and along with other symptoms, may be a sign of infection.
Okay, so it shouldn't hurt my baby when I'm cleaning the umbilical cord, and it definitely shouldn't look red or smell bad. I think I've got it. The infection can't be too bad though, right? It's a small area.
Even though it starts in a small area, the infection can actually spread to the blood and go anywhere. Small infections starting in the umbilical area actually cause a large amount of neonatal deaths.
Wow, I didn't know that. How can I ensure to keep it clean between cleanings?
One of the most effective ways to prevent infection is to have good hand hygiene. Make sure you always wash your hands before and after cord care, and preferably prior to handling your baby at all. Most people don't realize a baby's immune system is undeveloped, which leads to a higher risk of infections, especially within the first 20 days of life.
Okay, I guess I'll be washing my hands a lot more often now. Can I use hand sanitizer also?
Hand sanitizer is a good option for frequent handling of your baby, but it shouldn't replace washing your hands prior to umbilical cord care. Remember, you're handling an area that has direct access to your baby's blood supply.
This infection talk has me feeling rather nervous. At what point is it appropriate to call the doctor?
Actually, any of the signs of infection that we've already discussed are all good reasons to call your doctor right away. An infection won't just go away on its own, and it's important to get care as soon as possible. Can you remember the signs?
Yeah, I still remember. Let's see. It shouldn't be red or warm to the touch. There shouldn't be any smelly discharge, and it shouldn't hurt the baby when I clean the umbilical area. Is that right?
You remembered. Good job. I should also mention that anytime there's bleeding is also a really good time to call. For instance, if the umbilical cord accidentally gets pulled off.
Or if the cord hasn't fallen off within 4 weeks. Are you able to tell us when you need to call your provider and why it's important in getting quick care for your baby?
Okay, I'll be sure to call the doctor right away if I see any signs of infection. I understand that what starts as a small umbilical cord infection can lead to something as severe as death. I think I can handle 4 weeks of umbilical care. Thanks a lot for explaining things so clearly. I feel a lot less nervous now, and I know exactly what to do and when to call.
I'm so glad that you feel confident in caring for your baby's umbilical cord. We know that it can be hard to remember everything, so we provided a flyer to help you remember what we talked about today. And of course, you can always call us if you're not sure about something. Hey, Wesley.
Yeah.
Are you smarter than you look?
Yeah. Wait, smarter than I look?
Yeah.
I think so.
Are you sure?
I passed the T's.
Let's see.
Feel free to just put your answers in the chat. Wow, you're all smarter than you look. And these are our references.